Therapy and transplantation for balancing remitting multiple sclerosis. Multiple sclerosis. It is a autoimmune disease that affects the brain and spinal cord. Cause multiple sclerosis causes damage to the myelin sheath, the protective covering the southern nerve cells. When this nerve covering is damaged, nerve impulses are stopped. Nerve damage is caused by inflammation, which occurs when the body own immune cells attack the nervous system.
Multiple sclerosis, MS, is a disease that affects the central nervous system, the CNS, which consists of the brain, spinal cord, and optic nerves. Everything we do, whether it's taking a step, solving a problem, or simply breathing, relies on the proper functioning of the CNS. To understand how MS may impact the CNS, we must explore the disease at the cellular level. In the brain, millions of nerve cells called neurons continually send and receive signals. Each signal is a minute but necessary part of intricate CNS orchestrations that culminate in the actions, sensations, thoughts, and emotions that comprise the human experience. Normally, the path over which a nerve signal travels is protected by a type of insulation called the myelin sheath. This insulation is essential for nerve signals to reach their target. In MS, the myelin sheath is eroded, and the underlying wire-like nerve fiber is also damaged. This leads to a breakdown in the ability of the nerve cells to transmit signals. It is believed that the loss of myelin is the result of mistaken attacks by immune cells. Immune cells protect the body against foreign substances, such as bacteria and viruses. But in MS, something goes awry. Immune cells infiltrate the brain and spinal cord, seek out the myelin, and attack. As ongoing inflammation and tissue damage occurs, nerve signals are disrupted. This causes unpredictable symptoms that can range from numbness or tingling to blindness and paralysis. These losses may be temporary or permanent.
Stem cells. The human body contains hundreds of different cells, types that are important to our daily health. These cells are responsible for keeping our bodies to work every day to make or harvest. Our brain thinks that our kidneys clean the blood to replace the cells of our skin as granules. The special goal of stem cell is to form how that of osteocells did.
The human body contains organs such as bones, the brain, heart, and reproductive organs. The basic cells that give rise to all of the different cells in these organs are called stem cells. One type of stem cell is an egg cell from a woman that has been fertilized by a sperm from a man. This single cell, called a zygote, is the first cell in a developing human being. It's also called a totipotent stem cell because it can form any type of cell in the body, as well as the umbilical cord and placenta. After a zygote has divided a few times, it becomes an early-stage embryo called a blastocyst. Embryonic stem cells come from the cells inside the blastocyst. Embryonic stem cells are pluripotent. This means they can form any cell in the body, but not the cells in the umbilical cord or placenta. In the lab, embryonic stem cells are donated from leftover embryos created during in vitro fertilization. In vitro fertilization is a procedure to help a woman become pregnant.
Tratamiento. 3 years after receiving a stem cell transplant, a small number of patients with a particular type of multiple sclerosis, relapsing remission-free of paralysis of the DSAs, and improvement in neurological function. Patients were treated with high-dose immunosuppressive therapy and subsequently underwent transplantation with their hematopoietic stem cells. Conclusion. This therapy achieved an improvement in physical ability, cognitive function, and quality of life in people with relapsing-remitting multiple sclerosis. Although not cure the disease, stem cell therapy seems to be becoming effective for multiple sclerosis to improve disability, treatment of those effects, and therefore the quality of life. Ay, peluchita, me dañaste el video. Acute osteomyelitis in children. Staphylococcus aureus is responsible for 17 to 19 of acute osteomyelitis in children. Usually, the site of the infection is localized and tubular bone and blood vessels are metastatical, which commonly suffer the initial impact. Clinical manifestation. Most patients develop bone pain for 1 or more days, steady and gradual onset. The pain is usually fluctuating depending on the posture and movement. Infant children is localized, which is not often seen in infants or well present with pelvic osteomyelitis are localized in blood bone and only in 25% of cases affect or tubular bones or not.
It's a condition that can strike an otherwise healthy child, but knowing the symptoms of osteomyelitis can make the treatment much more manageable. We find out more in today's Health Matters. Bacteria, it not only lurks on doorknobs, keyboards, and playgrounds, it lurks in our bodies, whether we like it or not.
Everyone has a little bit of bacteria traveling around their system, and that can be caused by something as benign as brushing your teeth.
Sometimes the bacteria can travel into the bloodstream and affect the bones, a condition called osteomyelitis. Children are the most vulnerable. Pediatric orthopedic surgeon Dr. Matthew Wagner demonstrates how a child's knee can be affected.
They have leaky blood vessels. The endothelium are the cells that cover blood vessels, and they're not as tight, making this transient bacteria that's in all of our systems a little bit more likely to exit in these areas. The knee, in a skeletally immature patient, is affected in over 50% of spontaneous acute hematogenously spread osteomyelitis.
As Dr. Wagner explains, the bacteria can spread dramatically.
Once it has established itself within the bone itself actually has a network of what's called reversion canals that allows cells within the bone to communicate with each other. The bacteria can then use that to communicate.
That's when children start to show symptoms.
Which probably one of the most common is pain in an extremity, limp, especially in young children where they can't tell you, Mommy, it hurts here. You will see them favoring one leg. Certainly there can be swelling, there can be redness over the area, and fever. These are some of the more common.
Symptoms should not be ignored. Osteomyelitis can be treated with antibiotics. For those with more severe cases, surgery may be in order. I'm John Bafar. Infants can also be affected. The infection can spread to the joint and cause arthritis.
Diagnosis. The initial diagnostic is based on clinical suspicion. The erythrocytes sedimentation grade. Cultures of body. Point fluid and blood cells are helpful. The imaging study included radiography, scintigraphy, and in some cases, ultrasound and MRI.
In this video, you're going to learn about osteomyelitis and how it's treated. Osteomyelitis is a type of bone infection caused by bacteria that can affect almost anyone. Children who become infected usually have their long bones affected, particularly the bones in their legs. Adults typically see infection in their vertebrae and hips. Since almost anyone can become infected, it is important to understand what some of the risk factors are. Contributing risk factors for osteomyelitis include circulatory problems, including diabetes, artery disease, and sickle cell disease. Recent injury, like bone fractures and punctured wounds. Use of street drugs, non-sterile needles creating puncture wounds near the bone. Osteomyelitis can cause quite a few secondary complications. In children, osteomyelitis can damage the growth plates, which can lead to impairment in growth. Occasionally, the infection can move to the other joints, causing septic arthritis. In the worst cases, the infection can cause the bone to die due to a decrease in blood supply to the bone. Treating osteomyelitis can be a long process. Orthopedic physicians may suggest starting with a bone biopsy to help choose the best antibiotic to treat the particular infection. Antibiotic treatments usually last around 6 weeks and are administered through an IV. Many cases of osteomyelitis require surgery. Surgery may be done for a variety of reasons, including draining the infection, removing infected bone, getting blood back into the bone, or, in the worst case, amputation. If you are experiencing bone pain, a fever, and swelling, it is imperative to see an orthopedic specialist. The physicians at the Illinois Bone and Joint Institute are some of the best orthopedic doctors in the Midwest. Their experience and training in treating all types of orthopedic conditions, including osteomyelitis, make them your best choice for orthopedic care.
Treatment. Antimicrobial therapy should be institutional and how cause. The effects body and spirit for culture should be independent and the blood culturing is possible. Incision and drainage should be actually managed with their supragnostic access. Antibiotics would present ethical and guide Staphylococcus aureus include anti-staphylococcal, penicillin, clindamycin, first generation, cephalosporin, and vancomycin. Conclusion, depending on the early diagnostic and treatment, mortality is low and complication rates approximately 5% because of the various causes of the disease recommended. The treatment is individual for each case. Antimicrobial therapy should be institutional in all cases. The effect on spirit for culture should be anticipated while the blood culture is possible.